This is Q over here at the Brain Spine Pain Institute of Lake Nona, and today I want to talk to you guys about some of the things that we treat here at Brain Spine Pain Institute of Lake Nona. So, primarily when people see us, they think about the pain portion of brain spine pain, but we actually treat traumatic brain injuries here as well. When people hear traumatic brain injuries, oftentimes they think of the most severest of brain injuries, but as of recently, there have been really new research and discoveries regarding mild TBI, and then there's also an intermediate form called moderate TBI. So oftentimes, after a motor vehicle accident, individuals that we see are typically suffering from what's called mild TBI, or other people may also know this as concussion. So when you hear this particular diagnosis, know that this diagnosis isn't just one thing, guys. This is a multi-system diagnosis, right? So when we think about concussion, we can typically see signs and symptoms such as headache, pain, neck pain, dizziness, unsteadiness, possible weakness, difficulty sleeping, and even changes in emotion and memory. And so here at the Brain Spine Pain Institute of Lake Nona, we have a couple different things that we can do to help in regard to these areas. One of the things I'd love to show you guys, if you'll follow me this way, is our cold laser device. This particular device can be utilized in areas of discomfort and pain to provide you with relief, also help with inflammation or swelling that may follow after some type of motor vehicle accident. And then it can also help calm and relax muscles, especially after those car accidents and you may be experiencing whiplash and spasm. This can help manage that and make it lessen. And so we definitely are going to have this as a part of your treatment plan. If you'll follow me even more, we'll also have you working on a spine strength and stability program. Well, I know you guys just said, well, pain, but also associated with the brain is going to be how our spine works. So if you think about it like this, the brain is going to be the computer of the body, but then you have the wires running down from, which is your spinal cord. And sometimes after those whiplash accidents, we want to make sure that our spine is stable, nice and supported, and there's not pressure that's occurring along that spinal cord via intervertebral disc or other bony pathology that may have occurred afterwards. And so with this particular device, we have people clock into our facility and they rate their pain, they rate how they're doing and where it's located. So we have a really clean idea of what's going on. And then afterwards, we take them to our David machines over here. When you see these machines, they look like typical exercise machines, but in fact, they're much more than just typical exercise machines. These machines allow us to capture data that's associated with your back and neck. So if you're having difficulty as far as dizziness or balance, sometimes it is due to issues followed by the concussion, and oftentimes it's in combination with maybe some neck weakness or maybe some difficulty with coordinating your neck. We have multiple machines associated, so back, neck, able to provide you with all the data you need to see where you started and then where you end. If we want to get to the real nitty-gritty of what we do here in regards to brain injury, we'll introduce you to the Virtualis. So the Virtualis allows us to immerse you in a virtual reality world utilizing virtual reality headset and the virtual reality motion VR plate. In conjunction, these two devices allow you to be immersed in a world that challenges your balance, not only by just standing on some type of unstable surface, but by giving you visual distractions that you would have in life. So say you have difficulty going up and down in an elevator, maintaining your balance, or even getting dizzy, we can work with you on that here in this facility and it not be something that's embarrassing for you when you're outside of this facility. We provide you the comfort and confidence you need to be able to do this effectively. Even if it's motion sensitivity while being on a boat or while being in a car, all these things can be practiced and rehearsed here at this facility to give you greater improvements in function in regard to these things. And so what happens From a neurological standpoint, when we talk about brain injury, neuroplasticity is what happens. The key of what we do here is we want to make it specific for you. So what you're having problems with following the accident and sustaining your traumatic brain injury, and then what can we do repetitively? Because the more we do it, the better your brain will begin to create new pathways to be able to do it more effectively. One analogy that I love to provide people is thinking about when we first learned to ride a bicycle. When we first learned to ride a bicycle, we think about everything that's associated with that. Steering, balancing, pedaling, all the different things, right? But as we get more efficient with it, we get to a point where none of those things really matter. All that matters is getting from point A to point B. So if you're in that period right now following a brain injury, where you're thinking about everything, your memory, your balance, how you're walking and getting around, we're trying to ensure that with all the devices and all the talented people that we have here, we want you to be able to get to your point A to point B and not thinking about all the other things. Thanks. We look forward to seeing you guys soon.